For joining us on this edition of WMBC Hometown. I'm your host, Lisa Wojtycki. October is Breast Cancer Awareness Month, and here today in the studio is Dr. Rachel Wellner, who is a breast surgeon at Hackensack University Medical Center. Dr. Wellner, thanks for being with us today.
Thank you for having me, Lisa.
So as I said, October is Breast Cancer Awareness Month, and this disease has grown over the years. I mean, tell us just how many people this affects.
Well, thank you, Lisa. I think it's a very important question that you ask. And, we're still looking at a rate of about 1 in 8 women being affected with breast cancer in her lifetime. So that translates to about 12% incidence rate. This is just in the general population. This does not include women that are at high risk, have things like family histories or, other risk factors that would increase their lifetime risk of developing a breast cancer. But it's still 1 in 8, so it's significant. We're looking at about over 200,000 women in this country being diagnosed per year, and we still experience about a 40,000 plus mortality rate. So 40,000 women die from this disease per year in this country. It's still a big problem worldwide, bigger than that. And about 1% of all breast cancers occur in men.
Wow. So tell us, what exactly is breast cancer, and what are some of the ways that we're detecting it?
Well, Lisa, at its most basic level, cancer means uncontrolled cell growth. So something's happening at a cellular level to stop the checking process of cell growth. So cells are able to grow in an uncontrolled manner, divide and proliferate until they form a tumor or mass. At the next level, that becomes organ specific. So a cancer of the breast is that process occurring in the breast. But in its truest form, the breast cancer actually is a spectrum of diseases. So I would say that the cancers are as individual as the people that it affects. Meaning one woman's breast cancer can be very unique to that woman, although there are features in common with other patients being diagnosed with a breast cancer.
And what are ways that breast cancer is being treated?
We still have, standard therapy. In general, it includes excision of the tumor via either a lumpectomy or mastectomy. So the cancer has to be surgically treated as long as it's confined to the breast. It will generally include some form of systemic therapy, whether that be chemotherapy that is cytotoxic or causing cell death, versus an anti-hormone therapy or some other form of targeted therapy. We think of Herceptin as one form of targeted therapy. It may include all of the above. Oftentimes it does. And the addition of radiation therapy, particularly if we're doing a lumpectomy and we want to treat the remainder of the breast if we're conserving the breast. So radiation therapy is often involved with the treatment of breast cancer.
And you said 1 in 8 women are affected. So what can women do to be proactive in not only preventing themselves from getting breast cancer, but also detecting it? Are there things that they can do on a daily basis?
I think that's a crucial question, and one that we don't quite have the answer to in terms of, things that you can do proactively. In general, we know early detection is very important. So women have to get their mammogram. Now, that is not necessarily prevention, that is early detection. So that may not stop a breast cancer from coming on, but it will hopefully pick it up at its earliest point and enhance a woman's ability to beat the disease and survive from the disease and prevent it from recurring. So that's number one. In terms of what causes breast cancer, which is what you're speaking to, it's likely multifactorial. We don't know any one cause. We know that as a woman ages, we have an increased likelihood of developing breast cancer just because the machinery that protects us from developing mutations that will eventually lead to a cancer starts to break down a little bit, and some of the corrective mechanisms that we have in place get a little tired, and they don't do as good of a job of protecting us. So generally good advice would be to keep a diet rich in antioxidants, a healthy lifestyle, a non-sedentary lifestyle. We know that obesity can represent a risk factor for breast cancer. Excess alcohol consumption can represent a minor risk factor for breast cancer. Those are some of the things that we can control. And I would think anybody that has a significant family history of breast cancer, ovarian cancer, or other related malignancies should at least be tipped off to seeing their doctor and discussing her options with their doctor in terms of early prevention or early detection rather for high-risk patients and what can be done in that setting.
At what age should a person start detecting, or I should say be concerned, looking for signs and getting tested?
There's been some controversy lately in the media and in some certain societies about when we should, first mammogram should occur. There were some studies that came out suggesting that we should start later. I think most of us are still promoting the age of 40 for first mammogram and when we start to screen. And a lot of our societies are still, recommending the age of 40 to start paying attention to your breast health by way of mammography. We start doing self-breast exams and breast exams with your doctor at a much earlier age, at about 20. Mm-hmm. So I think it's a lifelong journey, and all women should get to know their breasts and any changes that occur. They should be very cognizant of changes that are occurring in their breasts and bring it to their doctor's attention. But at 40 is when we start mammographic screening for the most part.
Yeah, I mean, there's been a lot of publicity about breast cancer with the Susan G. Komen Foundation and also different celebrities speaking out about their personal journeys as a doctor, as a surgeon who treats so many patients. Do you see the general public's knowledge of breast cancer increased?
I think in general it's a very positive thing that celebrities are coming out and discussing their journeys and what they've gone through. I think that they brought awareness to the fact that you can receive this diagnosis or be a high-risk candidate, like in the case of Angelina Jolie, and still go through some sort of treatment or preventive therapy and be restored and be maintained and not seem different and go on to live a very normal, full, healthy, in some ways enhanced life. So I think that that's been a very important take-home message from celebrities being outspoken. But I would say to approach some of it with caution because her story is not necessarily the story of another patient being diagnosed. Everybody's story is a little bit unique. So Angelina Jolie having a BRCA mutation, which is in general relatively rare. It represents about 5% of all breast cancers. That doesn't apply to the majority of women. So I think that that's something to be taken with a little bit of a grain of salt and some caution, to not necessarily apply a story that's been featured in the media to a specific example, and to really undergo your journey with your doctor and customize it, tailorize it to you.
Mm-hmm. Do you think there's more hope out there with developments in technology and testing? Do you find your patients do have some more hope than maybe they did in the past?
Well, one thing is for sure, we've gotten pretty good in the breast cancer world. I think that we for early stage disease we have a very good survival rate, good outcomes for patients. So we've definitely made advances in terms of our standardized chemotherapy and our standard drugs. We've decreased toxicities, we've increased lifespan and people's ability to tolerate these treatments. Our surgeries have gotten more sophisticated. We include reconstruction as part of a mastectomy, usually at the same time. We do things like preserve skin envelopes and preserve a woman's shape and contours. Our lumpectomies are done with more awareness of maintaining the shape or enhancing the shape of women's breasts. So I think that the whole sequence of events is more palatable from that end. I think the exciting part is now in the world of genetics and genomics, which is looking at specific patients' genetic code and seeing what they might be at risk for, ways that we can prevent certain things from happening, and also looking at the tumor's genetic properties themselves to be able to consider targeting or individualizing treatment in the future. The more specific mutations or defects we can find, the more targeted therapies we can develop. But I say that with some caution because we still have a ways to go. And right now, we're learning a lot of information, and I would say we have to be responsible about what we do with that information.
What's the message that you want people to know, men and women, people of all ages, in reference to October being Breast Cancer Awareness Month or year-round in regards to breast cancer?
Well, again, I always, drive home the point of early detection and awareness, and I'd say get to know your breasts, men or women. I think, you should always be, doing a breast exam once a month or paying attention to any changes that are going on so that you can get to know your body to see if there's been a change or something that you should bring to the awareness of your doctor, because oftentimes that's how we'll pick something up. Even though the data really supports mammography over a lot of self-breast exams, I still think it's important anecdotally we pick things up. So that's number one. And the second thing is, make sure you're getting your mammogram when we recommend it. Just be aware of how certain risk factors can affect you. I think the patients are their own best advocates, and we work along with the patient to make sure that they get well.
Dr. Wellner, thank you so much for being with us today.